Now, when a patient usually goes to a sleep center, gets a diagnosis, gets put on medication, what do you feel the role of the neurologist and the primary care physician is from there on? How should they be interacting with the sleep specialist? What's your feeling, Evelyn, about that?
I think it's important they keep in close contact with the sleep physician, with the sleep center. Very often there's a certain embarrassment going on, like I don't know really too much about it, and I think that should be taken away. So the patient will be treated in the most successful way possible. I think that's important to stay connected with, and maybe sleep physicians should even offer, like, we can stay in touch, call me anytime if you have questions. Because if you just have one patient in your practice as a family physician, I think it's important that you get some guidance.
Yeah, it's a little bit more difficult now along with the new medications. I think a lot of physicians who are not seeing many patients with narcolepsy are probably not up with these latest medications. What would you think?
I absolutely agree, and I'll second what Evelyn mentioned, in that, for example, in narcolepsy type 2, which doesn't have cataplexy, some individuals may transition into type 1 later in life. They may present with cataplexy at age 30 or 40. So I think it's important to keep in touch and maintain that alliance in really looking for the development of new symptoms of narcolepsy. And the treatment armamentarium is really getting complex. So I think keeping in touch with the literature and knowing what are the specific types of medications and which are the patient types which they would be appropriate, and that again goes through mechanism of action and looking at comorbidities like sleep apnea. So the landscape is getting interesting. We're having more tools, but it's at the same time getting a little bit more complex.
If we can take the sort of same example that many of us who've been in the field a long time, we did a pretty good job of educating physicians and healthcare providers about sleep apnea. I mean, think about now how many people have been identified. I think we need to do the same job with narcolepsy that we did with OSA years ago. And that's going to take programs like this and others to make sure they understand all of the symptoms. And one last thing that I think you bring up a good point I'm not sure we touched on before, which was that when physicians are looking for narcolepsy in their practice, primary care or neurology, they have to realize that all of these symptoms don't emerge simultaneously, and that some of these symptoms can emerge down the road, sometimes even years later, and so that shouldn't dissuade them from still thinking it might be narcolepsy.